My name is Divya Nagpal. I was an intern with the Campaign for Better Healthcare, and I'm going to talk to you about how Obamacare has benefited me and how it's affected my family in many ways. So first of all, I am a recent graduate from the University of Illinois in Champaign, and I graduated in December of 2011, and I've not had a job since. And if this were before 2010, I would not have insurance. I would not have the opportunity to have insurance, and I don't know what I would have done. But thankfully, because of Obamacare, I am on my parents' plan, which has already served me very well. Last year, I was in a cycling accident, a pretty bad cycling accident, and I think my medical charges were something like $30,000. And most of that was thankfully written off because of insurance. If I had not had that, I would be God knows how many thousands of dollars in debt. So I am very, very, very thankful to be on my parents' plan. And it has seriously benefited me already. And also my parents are on a much better plan than I probably could ever afford. So I'm thankful to Obamacare for what it has done for me. In addition to that, my mom happens to be a primary care physician, and so I get to see the other side of things as well. So I've been on both the consumer side as well as the provider side. Since she's a primary care physician, Obamacare is extremely going to affect how she runs her clinic. First of all, she is going to have to provide for many more people who are coming into the marketplace, who are coming into Medicaid because of the expansion of Medicaid, because of the marketplace. All these people who are never insured, they're going to have to go to primary care physicians, which means my mom will have a lot more people coming to her. And given the other changes that are going to be happening, my mom has already gotten ahead on electronic medical records, which will soon be required for primary care physicians. So I helped her with implementing the medical record system, which she has in place, which has already shown how electronic medical records can really benefit physicians in being more efficient and being careful of where their money is coming and going and not losing stuff because they haven't written it down or forgetting about things or not turning in their claims in time. It really makes you efficient and makes you remember that you have to finish things on time so you can get paid. And also with meaningful use, she's going to get more money because she is signed on for electronic medical records. In addition to that, she gets even more benefit because she takes Medicaid patients, and in the state of Illinois for this year and next year, in the calendar year of 2013 and 2014, physicians will be getting the same rate as they would get for a patient with Medicare for Medicaid. So that means that they're getting paid finally, and physicians don't have to worry as much as they previously did for Medicaid payments to come in, which were immensely delayed and behind. And most of the time physicians got a bare minimal or nothing or just never got paid. So I think that those are some huge benefits from the Affordable Care Act, from Obamacare, which are helping me and my family. I come at you as a person, as an individual consumer. I come at you as a member of a small business, which happens to be a health business, and I come at you from the perspective of a primary care physician who will be extremely affected by the Affordable Care Act. So we are thankful for all that's been happening, and even though there's going to be some difficulties in terms of having so many more people come in, at the same time physicians are going to get more money, and hopefully primary care physicians, there'll be more incentive for people to go into primary care versus specialist work.